I love flying. No two landings are the same, no two takeoffs are the same. You know, it's just, there's always different factors involved in it. So it's always a challenge. And I grew up on the farm, so I've learned to deal with challenge. You want your last landing to be a good one. I had no idea what had been planned. The other pilot knew about it. And he says, did you see it yet? I said, what? And I looked, saw a whole bunch of people standing here by Maverick, and I saw the fire truck. That was pretty cool.
You know, in Sanford's history, it started in 1977, and so Sherwin started flying for the program in 1984. So to do a 42-year career with the same organization, doing air medical, business, and physician outreach flying, it's just not something you see that often, so we really wanted to honor Sherwin and the commitment he made to Sanford.
Well, I became the program director for AirMed in 1986. At that time, we made a decision to get our own Part 135 operating certificate, which simply means we didn't use vendors anymore. And we hired the pilots, the mechanics, bought the airplanes, and brought it all in-house. In 1988, when we did it, it was unheard of for hospitals to be doing that. We were one of the first in the nation. It wouldn't have happened without Sherwin. He's absolutely a cornerstone of the program. He wrote operating manuals, training manuals, developed a safety program, all the things you have to show to the FAA before they'll give you a license.
Well, and Randy was too. He had a lot of input and gave us a ton of support. Without his support, it would have been very difficult.
I can't think of a better thing to do than celebrate the legacy that Sherwin Bolks has built. Flown air medical patients, mostly, for the last 40 years. Been part of a team that has saved thousands of lives.
I've only been fixed wing, yep. I'd like my wings to stand still. The equipment kept getting better. They did not ever question any training that we did. Mechanics, you know, we have plenty of mechanics to get things done. You know, we have a huge parts inventory. You know, the hospital's always been supportive of us. You always, in any education, you get out of it what you put into it. You know, and you work hard at it. I have flown the ambulance planes to the four corners of the United States, bringing patients to specialties or bringing them home. I got to fly my own mom.
I will miss our cockpit conversations going from point A to point B. We've always had a great relationship. He's always in a good mood. He's funny, and he will definitely be missed, but boy, we will really honor the time we had with him.
And we used to do displays of the ambulance planes at air shows. The small airports would have an air show and we'd fly them down there. And I did a lot of them, and probably half of them, somebody came up, you flew me when my baby was born, or I rode along with mom, you know, when we went, and I, you know, how did it go? Great, no, she's right here. Yeah, so yeah, that worked. That worked. That does it. Yep. Well.
You're a charismatic guy. It's hard to forget.